As it is possible. It's like
Welcome to the call. And I think Leonard will be coming down. I just told his hair work, but she was excited to come down. Well,
So here you go.
Thanks for your Excellent. Thank you. Thank you for joining. Come on in. Come on in.
there's some iced tea and water back here. We're gonna have pizza.
Oh, okay.
All right. Can folks online hear me as well? Good.
Yes.
I'll try to project. So, welcome everyone. Get settled in. We'll get here eventually. It's been a while actually since I've done one of these talks. So this month, really broad topic. And so I try to hone in on the questions I get a lot as a primary care geriatrician. For those who don't know me, although that's fewer and fewer every month, Michael Danielewicz. I run our Pride Care program for LGBTQIA plus folks ages 55 and older at Jefferson. So, as always, I try to keep my slides to a minimum, and I want people to ask questions. I want to just give folks a bit of a heads up. I am not an eye doctor, nor am I an ear specialist. I know, as Dr. Clark does, a little bit about all of these things, but certainly I encourage folks to have other members of your team involved if you have more specific concerns. Starting with primary care is always a reasonable thing. As always, I have to give the disclaimer. Please don't make medical decisions based only on this talk. Talk to your own care team, even if that is me. And just a heads up, whenever we talk about eyes, especially, I am very cognizant of the fact that eyes gross people out. I do not have graphic photos of eyes or ears in this, so you don't have to avert your eyes. I have been surprised by some grotesque photos in the past as well. So, with all that said, let's start talking a little bit about vision. Hearing okay in the back? Little up? Perfect. So, we'll start by talking about vision. And the thing about vision is that it is constantly changing. Whether you are 5 years old, 55, or 105, your vision can change month to month, year to year. Some changes in vision are inevitable. And they actually start, this sort of change that I'm talking about called presbyopia starts in the 40s. People in their 40s become naturally more farsighted. So what people will notice is that their near vision may decline, and it almost invariably does. This is why pretty much every supermarket, every CVS you'll ever go to has reading glasses available. As folks age, the lens of the eye, which I'll highlight it here and then I'll point it out again for the folks online and for the folks in the room. The lens of the eye, as people age, gets more stiff. It doesn't do what we call accommodate as well. And the way it stiffens makes it so that far vision tends to be better than near. Now, is that 100% the case? No. If you have been nearsighted your entire life, requiring real glasses for reading, this may change a bit. But generally, if you have glasses like my partner, who he has a -7 or 8 prescription, he is not suddenly going to become perfect later in life. Now, some changes affect people differently with age. The one that I always bring up is cataracts. What is a cataract? It is another change to the lens of the eye that I just pointed out to you, where the lens is normally made of a clear material. They call it a crystalline material because you can see through it. Due to age-related changes, due to inflammation, due to changes in what makes up the lens of that eye, the lens can actually become cloudier. For some people, this becomes very noticeable, and we'll talk about what that means. For others, not so much. If I took a lamp, like one of those lamps that you look at with a doctor, with an eye doctor, they call them a slit lamp, and I looked in the eyes of everyone in this room, pretty much everyone over age 50 will have some degree of cataract change. So, when is it bothersome? And we'll talk about what the procedure looks like later because people worry about this. Nobody likes the idea of having their eyes touched. Well, some people do, but I'll say that that's not normal. So when it comes to cataracts, the things people will notice, night symptoms become noticeable first. People who drive notice, I can't really see those signs as well at night. People who spend more of their time walking will notice a little bit of a harder time navigating, whether it's seeing something far away, or most commonly, when you look at a light at night, people will often see a halo around it. So people ask me, well, at what point should I think about surgery? The answer to cataract surgery is that it is never an emergency. Meaning, if you are not ready to have cataract surgery, there is not a point where I tell you, you absolutely have to. The point where I start to say, hey, maybe we recommend this, maybe we consider it, is when the downsides of that change in vision become big enough to outweigh people's worry about surgery. Now, unfortunately, once the lens clouds, there is no way to clean up the native lens. There is not a way that we can go in there and brush off your lens and say good as new or even half as good. There are unfortunately not great vitamins and minerals that can treat existing cataracts. People who are at increased risk of cataracts are a couple of the following. People who use tobacco or smoke cigarettes, that increases risk of cataract. People who for other medical reasons have had to be on steroid type medications for a long time. Those are medicines like prednisone. And when I say that, I'm thinking longer than 6 months in your life. And 3, especially people, yes, over 50, but people over 70 are much more likely to develop cataracts. So we'll go through a little bit later what that procedure looks like. Most common surgical procedure in the country. Freaks people out to think about, but really is, from a technical perspective, a very simple thing to get done. Other vision changes. You don't need to necessarily say, but can people see some of the changes here on this screen? It's actually kind of hard to see with the contrast here. It's easier for the folks online. These little squiggles here and here. Some people in this room have probably experienced it. If anyone has ever flown on an airplane, you can particularly notice this, because if you look out the window at the horizon line, you often might notice floaters. Floaters are not a worrisome thing. They are, well, there's one exception to that. Was there a question there?
No.
I just saw that look. Floaters can come in a couple of different forms. They can be little dots. They can be little lines. They can be clear. They can be white. They can even appear as dark spots in the vision that move around. Floaters themselves are a natural phenomenon. The eye is nothing, I don't know, an eye doctor would kill me for saying this. The eye is basically a ball filled with goo. It's goo and lenses. And the goo, as people get older, called the vitreous fluid, the fluid inside the eye, it's always a little gelatinous, but as people get older, it can clump up and just form these little clumps that circle around in the eye. Those are floaters.
That's my question now.
Yes.
What about, I have the little dots occasionally.
Yeah.
Especially when I'm looking at television.
Yeah. Focusing on one point for a while can do that.
The other thing is I've had exactly when I turned 60, I have these masses that are going, of course, that are clear.
Yeah.
But I can see the masses.
Yeah.
And it's like, I know I'm not looking at things the way I did before I was 60.
Yeah. So that can also be on the floater spectrum. Floaters can be really small or they can be very large, depending on how big that bump is that breaks
I
up.
can see through them, but they're there.
The only time one has to worry about floaters is if you are sitting there doing your day-to-day and you notice a sudden flood of them across your vision, that's something you should get checked out. That can be a sign of changes to the retina or changes to the sac in the eye, where it starts to pull away from the back. Is there a question there?
Yeah. Is this possible? I used to have floaters and then I don't have them.
Yeah, they can settle. Floaters can settle. Floaters can be reabsorbed. For some people, there is a certain subset of people where, even though these aren't worrisome, for some people, floaters can become so bothersome that people start to fixate on them, or they'll really be looking for them and bothered by them. There are ways to treat them. People don't like hearing this. There is a way that an eye surgeon can actually take the fluid out of the eye and replace it with artificial fluid. It involves needles in the eye. Very few people like that idea.
Oh,
And I tell people, if it's something that you're noticing that it's out there, this is a normal thing that happens. I am 35 and I have these, so this is something that happens across the age spectrum. Is more common as folks age.
When you get dry, irritated eyes, do you suggest the drops that people buy? Cause I never buy that stuff.
Depends on what kind of drops. So dry eye is a whole spectrum, and actually I don't have a slide on this, but thank you for bringing it up. Dry eye can happen for a lot of different reasons.
I mean, like irritation. I get that from my allergies sometimes.
Yes. So
I
if you're,
get red and.
yeah, so are you asking about Visine?
Yeah.
Almost never do I actually recommend Visine. Visine
I'm
tears
feeling your reason.
with the actual, if you look at any eye drops, so I'm going to talk about two things here. First, red itchy eyes. If you see any eye drop that offers red eye relief, it does that by constricting the blood vessels in the eye. That is not a good thing to do long term. Now, if you do it once just to get through a day, fine. If you're doing it regularly, you can increase the pressure in your eye, causing something called glaucoma. Two, you can actually worsen the redness. It's called a rebound effect, because the body is like, I don't understand why this is happening. So the body will send more blood flow, not as good. So that's one thing. If you are looking for direct allergy treatments, like you're getting dry allergic eyes, like itchy allergic eyes, there are specific medicines for eye allergies. Before you use them, please talk to your doctor, at least your primary and ideally an eye doctor. The brand name, Olapata.
Yeah, had a day.
Pataday. I know the brand. I always try to give you
Prescribed by my doctor.
that. So there are two. One is over the counter. Patanol, the one that you have to use multiple times a day, is available over the counter. Pataday, the once a day, I think is still prescription. Correct me if I'm wrong.
That's right.
I try always to use generic names, but honestly, I cannot remember it for this one. I'm sorry. Olapata something. Those are actually direct. They treat the cause of allergies, which is histamine. Whole other. That's actually a great
And
topic
I'm
for
allergic to
people.
my cat too.
Oh, Sam, I live with two cats and I'm
And I-
allergic to.
And I wash my hand, like if I pet him, I rub my, I
Doesn't
get,
matter.
yeah, I wash my.
Doesn't matter how long you live.
Doesn't
with them.
matter if I wash.
Exactly. So generally, you want to be avoiding Visine for red eye though.
Who is
Dry
that
eye
person?
is a whole other. It's a whole other thing. Allergies can cause it. Changes to some of the glands that lubricate the eyes can cause it. General over-the-counter eye drops, the stuff you see that is basically saline for the eye, it is very, very difficult to overdo it with that, just to be clear. Now, there are some that have preservatives in them that'll make people itchy or irritated. If you buy a general saline eye drop that has minimal preservatives, go crazy.
I
Now-
just use cool water.
That's fine.
That's it.
That's
And I'm fine.
completely fine.
Yeah.
Good.
But my friend uses that Visine stuff. My son, he uses
Yeah,
that,
you really.
and I try and tell him, you use that too much.
When I first met my partner,
Not listen to me.
and we moved in together, I saw the Visine and I'm like, hey, what do you use that for? And he was like, oh, whenever my eyes get red, 3 or 4 times a week. Don't do that. Now, floaters are one thing. I want to get back to this.
maybe I have to live with a doctor.
Maybe. Although he's a nurse, so he knows now.
And I was just wondering, does that like come with old age, like when you get older? Cause I just turned 60 last month. And I noticed changes before this age, but I'm just wondering, is that something that happens?
Not necessarily allergies. I'm
The
sure
dryness and stuff.
the dryness, yes, changes to the glands to the eyes.
Okay.
They're called meibomian glands. They help to create the tear film. Those glands do change with age. So folks, as they age, especially 60s, 70s, 80s, and beyond, do tend to report more dry eye than those under. The reasons why, if you know you have dry eye, I do recommend evaluation. Because there are tests that eye doctors can do. They'll put little basically pieces of paper at the edge of your lids and see how your tear film is producing. The eyes should theoretically be covered in a thin layer of tears at all times. Yeah. Sorry, I was going somewhere with that and I totally forgot. Thin layer of tears at all times. If over a long period of time that tear film dries up, you can cause changes to the actual structure of the eye. So ideally, we're taking care of it before that.
What was the name of that thing on your eye? It's called?
Uh,
It's not a tear duct, it's something else.
meibomian glands.
That's.
Yeah.
I
Now-
think I won't remember that.
That's okay. You have quite a, So we were talking about floaters, then I got sidetracked. That was a good discussion. Floaters can be normal. You see things that look like this, unless they appear suddenly, generally fine, generally normal. If you start seeing, this is not the sun, just to be clear. If you are out in the world and you start seeing sudden bright flashes of light that are appearing in different parts of your vision, that is not normal, especially if it starts abruptly. That can be a sign, that is a sign that you need more urgent eye care. I tell people don't wait on this. Reason. The eye, I mentioned the front of the eye where the lens is, the sac inside. At the back of the eye is where all the business happens. That's where all the cells that take light, process it, reflect it, flip it around. It's a whole process that gives me a headache to think about. The back of the eye can be very fragile at times. And that layer of cells can pull away from the back of the eye in a process known as retinal detachment. Anyone who has had a retinal detachment and who is familiar with seeing these sudden flashes of light, often accompanied by a big mass of floaters, you tend to remember it because it's a pretty intensive thing to go through. If you see these flashes of light and they are new to you, get seen by an eye doctor ASAP.
Doctor, this is George.
Brings us to the common question.
Can you hear me?
How often do we
well.
need eye exams? And this is a really controversial topic because if you talk to the American Academy of Optometry or the American Academy of Ophthalmology, they will say everyone should get an eye exam every year. I'm trying to be practical here. Most people I talk to have not had an eye exam in a long time, like too long, honestly. Most people. The CDC recommends, the CDC or what remains of it, recommends an eye exam every 1 to 2 years. They actually say every 2 years. The ophthalmologists, the eye surgeons, and the optometrists, the eye doctors will tell you every year. If you have diabetes, that is a whole other set of conditions that can come up. Diabetes affects blood flow to the eye. It can cause new blood vessels to grow at the back of the eye. It can cause the blood vessels you have to change, a process called diabetic retinopathy. If you have diabetes, you really should be seeing an eye doctor on a yearly basis to have an eye exam. What are the other things, the kind of as needed? If you notice an abrupt change in vision, and by abrupt, I mean you wake up and your vision is different, don't delay on that. Red eyes, if they persist, we're going to go through my little point of this is not all red eyes are pink eye or conjunctivitis. Double vision is often a challenge. There are a number of causes of double vision, whether it's from within the eye itself or within the brain, that should be evaluated. New onset of a lot of floaters, sudden flashes of light, or if you're getting halos around lights and they're starting to really bother you, again, reasons to be seen. So what an eye exam looks like is going to depend based on who you are, what your needs are, and what who you're seeing to some degree. Almost every single eye exam, not almost, needs to start with a vision exam. It can do it far off and close, but the far off vision testing is most important. They will then often do what's called a refraction with the lenses where they check to see how they can correct. The part that everyone loves is checking eye pressure. Has anyone here had a negative experience with that? Or just an experience at all?
They told me.
Yeah, they're not, I mean, it's not fun.
You said it's fun.
Yeah, I mean, low eye pressure is not the word.
I didn't go back though. They wanted me to buy glasses and I was like, oh.
I got you. I got
Sometimes I have to do it twice when I'm there.
Yeah. I have long eyelashes. I always back away from it, and then So why are we
Dr.
tormenting
Danielewicz,
people
can
with
you
these eye pressure tests?
can you hear us on the
Because eye
chat?
pressure, much like blood pressure, and the two are related, matters. That process I mentioned called glaucoma. Glaucoma affects the edges of our vision. Glaucoma happens when the cells that are responsible for us seeing out here or out here when I'm looking forward become affected, often by high eye pressure. So we have to measure it. And how do they do that? They numb the eye up and put a little device right up against the outer part of the eye and press very gently. There used to be a process, increasingly less common, where they'll use a little puff of air and determine the air velocity that makes the eye bend. It's kind of
God,
easily distracted by dogs.
I don't know what's
That
happening.
one is not as well known or liked. After the eye pressure test, we do a little bit more to you. They will put drops in to dilate the pupils, make them large. And this is actually a really essential part. This is the part of eye exams that I see people not wanting to do or wanting to skip out on, because those drops that they use to dilate your eyes and make your pupils as big as dinner plates last a while. It can make you a little more sensitive to light if you have to drive later in the day. It's not like you can't, it just means you have to pay extra attention. Dilating the eyes makes it possible for the eye doctor to get a really good view of the back of the eye. The back of the eye is where a lot of the action happens. So you want to, especially if you have chronic medical conditions, especially if you have diabetes, you want to be putting up with that fundoscopic exam, the dilating and the looking at the back of the eyes. Question?
I just wanted to mention, I assume you know, there is now a hardware equipment that will examine the eyes without dilation.
Yes.
And it's not covered by medical insurance, so you have to pay for it. Last time I had it, it was like $40.
Yes. So, and it is interesting because if you ask, it depends on who you ask what the benefit of that is clear, in that it is better to do that than not to do a dilated exam. A lot of the ophthalmologists, the eye surgeons I work with will say, still not as good as me having the ability to adjust my lens and look at different angles. So for, say, diabetes screening, it is still the gold standard, the best standard is still to do the dilated exam. But that is another option for folks who can't, don't want to, it's just not fitting in with their life.
But you don't think it is that good? It's dilated.
I think that the dilated exam is still the best exam.
Okay.
Tell me if you disagree, Dr. Clark.
That's the, yeah.
Yeah, it's still the global recommendation.
Yeah, I don't know the data to compare.
I don't either,
Yeah.
admittedly, but
Yeah.
I do know that the eye doctors feel strongly about it. So when we think about, when I say eye doctors, I throw around these terms. I do want to just highlight the ophthalmologist optometrist difference. Both essential parts of the team, to be clear. Your optometrist is what most people in this country that are going to see for their general eye care. Their degree is an OD, optometric doctor, doctor of optometry, OD. So an optometrist has gone through 4 years of undergraduate training and 4 years of eye-specific medical training. They go to optometry school. Some folks coming out of optometry will be doing an additional year or two of residency, but it's not considered mandatory. So optometrists are providing the bulk of routine general eye care. Some folks will call them the primary care of the eye world. I don't know if optometrists like that phrase, but that's kind of how I tend to think of it. Optometrists can do eye exams, front and back. They can look for cataracts. They can look at the back of the eye. They can do what we call refraction for glasses, and may in fact have, this is my hot take and mine only, not representative of anything. If I'm getting glasses fitted, I may choose to see an optometrist because they get a lot of training in that. Now, this is not to say that there are not some optometrists who do more advanced care. That is going to vary intensely by a number of things. One, state by state optometry licensing is pretty different. Two, individual practice and patterns. But if you are needing surgery, procedures, laser surgery, LASIK, in just about every state, very few exceptions, you're going to end up needing to see an ophthalmologist. Aside from being really difficult to spell, because everybody forgets the second H, including me sometimes, ophthalmologists are medical doctors, either MD or DO. How's that for confusing? DO, not OD. They have gone through 4 years of undergraduate training, 4 years of medical school, and then a 4-year residency in ophthalmology. They do, at least in this area, tend to be more procedurally focused. So for those folks in this room who are considering having a cataract surgery, who may need LASIK or another procedure, you're going to end up seeing an ophthalmologist. MD, DO, doesn't matter in that case. So what do I tell people as far as eye care from the primary care world? How do we preserve vision? UV protection is one of the biggest. There is actually, the old wives' tale was people with lighter colored eyes like me are more sensitive to sun. Guess what? It's actually true in terms of UV protection. If you have blue eyes are the worst, green eyes are slightly better in this sense only in this sense. Blue and green eyes allow more UV penetration to the retina. So, especially if you have fair skin, fair eyes, in addition to putting on sunscreen, you should be wearing sunglasses, using a hat when outside as much as possible. Everyone should, because long-term sun exposure, UV exposure, does end up damaging the cells that process light, color, and vision. Quitting smoking is also essential. Tobacco, in addition to being directly toxic to the blood vessels leading to the eye, actually directly harms not just the lens of the eye, but also the vision cells in the retina. Managing your chronic stuff. This is where we come in. Things like diabetes. Diabetes affects the back of the eye. High blood pressure can cause glaucoma. High cholesterol can change the deposits that end up at the back of the eye. There is also independently a link between regular and moderate intensity exercise, 100 to 150 minutes a week, has been statistically shown to slow the decline of vision with age. It's very non-specific, but exercise is generally a good idea, and so here's where it applies. People always ask about vitamins for eye care. Now, this is a little different if you have a condition called macular degeneration. There's a whole subset of vitamins to take for that. I'm not going to get super into that because it's really specific. When it comes to vitamins, I generally tell people for eye health, you generally don't need to be adding supplements in. I say to look to your diet to really get what you're needing. The one that I do caution people on, there's a lot of word on the street out there and some data to back it up about vitamin A and its benefits to eye health. I generally don't recommend supplementing vitamin A for most people, especially those who have ever had a tobacco history. Because in those folks, vitamin A supplementation in particular, A as an alpha, can actually increase the risk of a certain type of lung cancer. So before you start supplementing anything for eyes, just talk to your doctor. And this is some helpful foods that I admittedly cannot see from my angle that naturally give you those things. Jimmy,
What if the A is in your general vitamin?
it's if it's general vitamins have such a low amount of vitamin A that it's generally just fine. Vitamin A supplements like the mega doses, like so you think about an average multivitamin. I use vitamin D as an example because I know that one. An average multivitamin will have like 400 units of vitamin D. You go out there and buy a standard vitamin D supplement, they can have 4, 10, 15, 50,000. So same with vitamin A, the levels that are in a general multivitamin are usually much lower. Oh, a lot of questions.
How about the carrots? That's good for eyesight.
Yeah, beta carotene. Yeah, beta carotene, vitamin A.
And I hardly ever eat carrots.
And that's okay. It's not like you have to start eating carrots. Fun fact, it's very easy to tell an overdose on beta carotene. Remember this? I saw this once in residence. There is actually in people with a certain certain processing difference, you can see a yellow tinge to skin with an overdose of beta carotene. Not a bad idea, but not like you have to start housing carrots. We got a couple of questions. We'll go front to back. Yes, that'll cause different problems. Let's start with.
Don't you have to take vitamin K with vitamin D to make it work?
can increase absorption, can also cause problems with blood clotting, so be very careful before you do that. Talk to the doctor. Mary.
I was told I have slight age-related macular
Yes.
degeneration, and I was told to take ARIDS.
Yes, I will bring that up. So
Okay.
there is, for folks who have any degree of age-related macular degeneration. So we're going now to the back of the eye, to the central part of the back of the eye. It's called the macula. In some people, for a variety of reasons, that can change. And that can cause disturbances to not the edges of vision, but the center. There is a very well-studied set of vitamins called the AREDS formula. What that stands for, God, I don't remember. If you don't mind looking that up, Dr. Clark, just to... But AREDS, and then there is AREDS 2. The general AREDS has a pretty good amount of vitamin A in it. AREDS 2 is specifically formulated with a lower amount. So usually your eye doctor or primary will direct you in one or the other. There are some people who have a strong family history of macular degeneration, who may just start taking an AREDS vitamin is generally a pretty good multivitamin, admittedly.
So it's a genetic thing?
It's actually really poorly understood. There are genetic factors.
Okay.
But yeah, it's not necessarily, it's one of those multifactorial things, which is to say we really don't entirely know.
I'd like to pitch big time for regular eye exams.
Yeah.
Many of you know I have an eye issue. I'm legally blind, which is like 20/200 vision, which I'm not sure if you explain what that is, but
I haven't yet, but I can.
don't be a wimp about getting your eyes dilated. This is so important, especially for older people. I have macular damage, not degeneration. And you can monitor that. I can't speak more highly. When my thing happened, I went the next day, and now they have an actual treatment for macular degeneration, which I don't have. I didn't know at the time, but I was able to at least not go completely blind because I saw somebody that just jumped on it, but I just don't have exactly a comment, but I just want to pitch for not put it off.
No.
It's like, especially as we get older, it's a huge deal.
I'm with you. And I'll say eye exams are one of those things that we all recommend, at least routinely. And again, of all and when you think about the patients you see, of all the exams people aren't getting, this is probably up there. So I would strongly, I thank you for bringing that up and sharing.
What other fruits can we eat that'll help us with our eyesight
So,
as we get older? Like, what are anything you can recommend?
so specifics, oh boy.
Just like, is it fruits or veggies?
It's generally, I mean, I'm thinking about our list here. I mean, of course they have your carrots. The green leafy vegetables tend to be really good on the vitamin C and E front, which there's been pretty good data around that with vision. But it's kind of, in general, when it comes to vision, and we'll talk hearing too in just a moment, it's not like there's one magic fruit, because now antioxidants are all the rage here. I mean, what even is an antioxidant? Let's put it that way. The idea of antioxidants is that they are picking up and kind of kicking in the butt some of those inflammatory processes that the body naturally has. So there is probably somewhere out there, somebody online will tell you if you eat a carton of blueberries a day, your vision may be better. I generally encourage people to have a broadly balanced diet. So I'm sorry, I know that.
Pizza's good.
If it shows up, yeah. Yes.
Online, I'm on all day long.
Yeah.
Everybody's talking about blueberries.
Yeah.
A couple people are saying this is horrible, don't do this, and everybody else is saying you must be stuffing blueberries in your mouth all day.
Yes, you have to. Yep.
And is there a reason for that?
So it goes back to that idea of what does an antioxidant actually do?
Okay.
And biochemically, I mean, an antioxidant from a biochemical perspective sounds great. It neutralizes these things that are released in inflammatory processes called free radicals. I'll tell you, there is a lot of hokum out there about free radicals and what they do to people. Are blueberries the cure-all? No. Are they bad? Also, aside, unless you're like horribly uncontrolled diabetes. They're not terrible. They have a lot of sugar. The benefit of blueberries in general health is kind of still up in the air, let's say, unless Dr. Clark has more data than I do.
How does blackberries fit into that? Because they're less sugary.
Good question, admittedly. I'm gonna be honest. We need to get a nutritionist out here. We really do. To go back to Ms. Allen's point about when you get those numbers, 20, 200, 20, 20, what they do, and in Europe it's a very different standard because they use metric system. When you are standing at an eye chart, you are a given distance from the eye chart. You are supposed to be 20 feet away, or they simulate it with the size. 20/20 means that what an average ideal vision should, a person with ideal vision sees at 20 feet, you're seeing at 20 feet. 20/10 is actually better than 20/20. 20/10 means that what an average person can see at 10 feet, you can see at 20 feet. 20/200 or 20/100 means that when you're compared to a population mean, your vision is lower than that by a certain factor. The threshold for legal blindness does not mean in general that one cannot see at all. Legal blindness threshold is 20/200 in both, usually both, well, in one eye at least would be considered legally blind. So, the last point I want to bring up before we move to hearing, because I know this is a huge topic, is just cataract surgery. People come into our office all the time, getting ready for this and really worrying because no one likes the idea of their eyes being messed with, God forbid, cut. Cataract surgery is a common procedure. It is really, really quick. It is about 15 minutes in and out. They end up having to take out your lens and replace it with what's called an IOL, an intraocular lens. It looks like that. It just slots right in. Procedure itself, like I said, 10 to 20 minutes. They generally will use some mild IV sedation and some topical drops. They use ultrasound under guidance to break up your natural lens, remove it with a small suction device. And then they insert this lens, which gets folded up into tiny pieces. It unlocks in the eye, and they place it with tiny stitch work. It's actually a very interesting procedure to see done because it's, from my perspective, artwork. I say this as somebody with big hands who's very clumsy. Ophthalmologists do very small work. It's a good idea if your vision is affected. So my key points with this. Remember, not all eyes are red eyes or pink eye. We get this question a lot. Pink eye, most pink eye admittedly is also not bacterial. It is usually viral. If you develop both eyes that are red with some crusting, the first thing I usually recommend is trying warm compresses for a day or two and seeing which way things go. If you have one eye that is red, crusty, just really getting you, we may try antibiotics. The reason I don't just throw erythromycin ointment or antibiotics at everyone is not even resistance, it's that it can be really irritating to people's eyes. People will develop a reaction that is not an allergy, but an actual irritation reaction to the stuff. So the last thing I want to do is harm you. It's not like I'm being stingy on antibiotics. I want to see if this truly is something that needs them because the risk there exists. Primary care is always happy to hear your concerns with anything, but I do recommend, as Ms. Allen pointed out, that it's important to have a dedicated eye care team too. They have a ton of training. Dr. Clark, how much training in ophthalmology did you get in medical school?
A handful of lectures.
I would say 3 days worth of lectures max for me. Now, we learn things on the job. We also don't have the specialized tools. I can look at something with a, what we call a Woods lamp. We actually have one in our office. I haven't used it in years. We can look at the eye, we can put special drops in. Eye doctors can do all of that and then act on it. We are fortunate to live in a city with multiple places within. There's literally an eye emergency department within walking distance of here, which is not something most places have. Will's Eye, Penn, and Salus University all have their own eye emergency setups. So if you have any of these things, sudden loss of vision, sudden doubling, acute change in vision, I really tell people not to wait. You can always reach out to us, but oftentimes I'm going to say, hey, I really think this is something that needs Will's eye. So, questions about eyes?
Where did you get pink eye?
Pink eye, everywhere. The world is surrounded by it.
Services or other people?
Both. Mostly, when you get pink eye, it's often caused by a virus that you caught from somebody else. A lot of the common like adenovirus, which is it can be. It's not like pink eye is not a dedicated virus usually. It's usually part of something that you have otherwise. Like you might have an adenovirus, which is a common cold and it affects the eyes.
I remember they did a whole episode of Big Bang Theory where they all called pink eye.
Oh yeah, it's very common.
And
Very
they
common.
were screaming, cheering that we found out it was bacterial and not viral.
Yeah, it's bacteria you can treat. Viral, you just gotta kind of wait until it gets better. Yeah. Nobody ever likes that answer with anything. No. So, with that said, pivoting to hearing. Hearing also changes. Oh yeah,
I
sorry.
have a comment on eyes while we're there.
Yeah, please.
When you mentioned the flashing in your eyes as being dangerous, and you should seek immediate help. You didn't say, however, there is a condition where the gel in your eye is shrinking and causing minor flashing on an ongoing basis.
Yes.
In which case it's has not yet damaged the retina, but it could be.
Exactly.
So like I've been having this for almost 5 years.
Yes.
And every year the doctor examines and says the retina is still good, but the gel is shrinking and you're going to continue to see some flashing.
Which is exactly why when I say that, anytime it's new, I do recommend really prompt evaluation. Because it's really when you know something is happening, which you do, it sounds like that's a good thing, and you monitor it. I don't recommend that people take that thought on their own necessarily for a first occurrence. Because it can be hard to tell. And with vision, unlike many things, vision can run on a clock. That's why I'm not trying to panic people here.
Right.
But I think it's really appropriate when you're the first time to get an evaluation ASAP.
Absolutely.
And then you can have a baseline of your.
Exactly.
Obviously, sorry, this is like such a big.
Please, no, I think
Topic for me.
the experiences people have matter always, but especially when you have something that affects vision. People obviously care about that. And you should. I mean, it's such an essential aspect of day to day.
And we were talking about macular is your central vision, so
Yeah.
if people look at me, I tend to like operate in my peripheral vision,
Mhm.
so I can walk around and act like I'm just like normal. Ooh, but if I look right at you, especially if you're maybe even just 10 feet away from me, I can't, your complete face is a block.
Yeah.
So it's to deal with any of the stuff. You might differ, but to me, it's like the alarm bells are always appropriate.
Totally
when
hear you.
something happens with your eye.
Totally.
I have one quick question.
Yes.
Let's see. All my life, my eyes change colors. They get hazel, they get brown, they change colors.
That's interesting.
People notice that, especially when the light hits it. So
Yeah.
does it have to do with, is it something that you
So
hereditary or?
eye color is fascinating. Actually.
Yeah, fashion.
There is a certain subset of the population where the pigments in the iris, the colored part of the eye, will actually change with time. You sometimes see that with small children as they're growing up. There is a condition called heterochromia where some people even have two different color eyes. Some people, and I'm one of these people, the
And
pigments.
kids too.
Yes, the pigments in certain people's eyes, because they have aspect. Nobody's eyes, well, not nobody. Most people's eyes are not pure blue or pure green or even pure brown or pure. People will have some other variants. So to some degree, my eyes look different if I'm wearing blue, green, gray, or brown. People will tell me when I'm wearing green, my eyes look green because I have green pigment. The base color of my eyes under a slit lamp is actually really a blue, similar to the color of the sweatshirt you're wearing in the back there. So it's really, eye color is like.
People talk about, so I just was wondering, because you know a lot about that.
No, it's
And sometimes
fascinating.
they're really green and then.
Yeah, and there are artists out there actually. This has become a big thing. who will actually take really high intensity photos of the retina and blow them up. It's really cool to see. Yeah.
In the old days, in the fifties, you had hazel eyes.
Yeah.
The hazel people who had hazel eyes, their eyes would change from blue to green.
Yeah. Yeah. Hazel is
You know,
often
same
the
thing-
color that many people's eyes get to. In general, if eye color changes over a lifetime, the general trend to my knowledge is darker colors with time. So I am, of course, going to shortchange hearing because I hurry up and get through it. But signs of hearing loss. I mean, some of these are, some of them are not. Some people are going to notice that they're having more trouble understanding. People are asking people to repeat. Sometimes we go into someone's apartment and say, hey, your TV's really loud. Taking that feedback and just kind of thinking about it in overall context can be helpful. Some people think that others mumble. My partner's dad says everybody mumbles. I'm like, no, Tim, you do. Sometimes your hearing is not bad. That's the reality. So there are two big buckets of hearing loss that I think we need to think about. Sensory neural is the more common one and the one that we really need to be thinking about, because that is sound coming in and either not being processed properly, there being damage to the processes that do that. Conductive hearing loss is technically a lot easier to treat. It's why whenever you go to your primary doctor and you tell them my hearing has changed, they should look in your ears. Because if they are full of wax, you are not going to hear as well. So we can certainly treat that. There is also a type of hearing loss there are a bunch of types of hearing loss that fall somewhere in the middle. Sometimes when people have infections that can damage hearing or that can change hearing temporarily, there are a variety of genetic disorders. Some people who have certain forms of head trauma that actually change the ear canal itself. So, I'm gonna not do this because this I just realized on these speakers will not work, but I'm gonna ask Ed to send this out to folks because it is an interesting little exercise. What I will say about this, I'm just gonna pause this for a second so that it doesn't start screeching at us and giving us ads. Hearing invariably changes with age. And by that, I don't just mean 55, 60. I mean that the peak hearing is at approximately age 16 to 18, and it is all downhill from there in some way. And what does that mean? It means that people's hearing of higher frequency sound, the shriller sounds, diminishes with time. And it starts diminishing right after in one's 20s, picks up in the 40s, and then it can, in certain people, very quickly accelerate in 60s, 70s, and 80s. So what I have here, it won't work with these speakers, but what I'll do is I'll send it to you. I'll send it out, and if you put headphones in or on, and you listen to this at home, it does a pretty good job. Make sure you have it on the highest resolution possible. It will actually play a tone starting at a certain frequency and then raising it. And it'll say the average. Now, this is a non-scientific test that you're doing at home, but I know my hearing isn't good. My partner and I did this last night, and he's like, haha, I knew you couldn't hear. Maybe I just don't listen. But this is something that we can look at. Why does that happen? The ear is a really complex thing. I didn't put diagrams up of it because it gives me a headache to look at it. But deep in the ear, if you ever see a conch shell, the ear looks just like a conch shell spiral. There are these things called hair cells. And hair cells vibrate with frequencies. As people get older, those hair cells essentially stop functioning to the same degree. There are some things like, I guarantee you, if I brought an 18-year-old person into the room today, assuming no one else, no one in here is 18, he or she will have better hearing than anyone in this room. If I brought in the average 18-year-old right now, like average meaning doesn't have any specific genetic conditions or unique differences. So the question then is, what do we do about it? Well, first of all, we need to be aware of what we do to maybe worsen hearing without thinking about it. There are certain now, please don't stop your regular medicines because you're worried about hearing. Talk to your doctor if you're worried. There are certain antibiotics that are known to affect hearing, often the heavy hitters we rely on in the hospital. Things like vancomycin. Very high doses of ibuprofen. This is why I hate ibuprofen 800. People who are taking that multiple times a day can directly damage the hair cells of their ears. Same with high doses of aspirin. And by that, I'm talking people who take 325 of aspirin multiple times a day, which you shouldn't do for many reasons. This one's not controversial because it's known, but it worries people. People who are on water pills like furosemide. Furosemide or Lasix is a really common medicine used for a variety of things, in particular folks with heart failure. If we use a dose of Lasix that is too high, we can directly damage the ears. High dose of oxycodone, morphine, opioids. What a high dose is varies very much on the person, but something to be aware of. And then we get into some of the more specialized stuff. There are certain cancer treatments that almost invariably cause hearing change. If you ever need to be on a platinum-based chemotherapy like cisplatin or carboplatin, your doctor will mention that as one of the things to expect. To be clear, these first 1, 2, 3, 4, including opioids, including Lasix, this does not happen to everyone. It is a small subset of a population. Those last two, high doses of chloroquine or platinum, it's a much higher rate. So, what should we do about ears? Maintaining good ear health. If you are worried about your hearing, or if you are being told that your hearing is not what it used to be, please get it checked. Hearing relates to a lot of things that we're going to talk about in just a minute, but hearing relates to people's ability to interact with the world, and that directly relates to memory. So if you are noticing that your hearing is not what it used to be, if others are telling you that, I recommend, and we've actually had a pretty good run at getting people to do it, getting an audiology evaluation. Other things that you can do: don't stick Q-tips in your ears, please. It literally says it on the box. These are not for sticking in the ear. Well, it says that in nicer words. The ears are generally good at cleaning themselves, generally. What you should be doing when you wash your ears is taking a washcloth right into the outside, and that is it. Don't stick things in. If you are one of those people who builds up wax, either tell your doctor about it and let us help you get it out, or there are a few other things we can talk about. But please, Q-tips in the ear, not a great thing. Volumes should be reasonable. A lot of people use iPhones and AirPods or something next to an iPhone. An iPhone will tell you when your volume's getting too high. Please listen to it. 80 decibels is generally considered really high volume. So if you are going out to a really loud concert, if you are walking down a street where they are jackhammering on the street, reasonable to pop a set of earplugs in. Then the last one, quit smoking. Generally good advice. So people really freak out when I say no Q-tips. If you are concerned about clogged ears, there are a number of things that we can do from the medical side, ranging from flushing them out with water to using a small instrument to pull the wax out, to, if it's really hard to get stuff out, our colleagues at the ear, nose, and throat office have a tiny little wax vacuum that sucks it out. It's really kind of cool. Some people, it is available over the counter, will try something called Debrox. Debrox is just a concentrated hydrogen peroxide solution. And if you are diagnosed with wax, or if you know you get wax, it's reasonable to do that every once in a while. But you don't want to be doing that multiple times a month, and certainly not daily, because hydrogen peroxide dries out tissue. You can really affect the integrity of the ear canals. So talk to your doctor before doing that. Sorry, I'm starting to speed up because I know we're running out of time. One of the big challenges with everything we talk about in American healthcare is always cost. It's consistently a challenge. And many people in here will be insured by Medicare. If you are insured by traditional Medicare, aka not an Advantage plan, the evaluation for hearing is always covered. You can get a hearing evaluation once per year on Medicare, and that is a covered benefit. So what that involves is they will play a variety of sounds, and you'll have to indicate when and where you can hear them. They will then generate an audiogram that tells us where and which ranges your hearing loss is. From there, a good audiologist will connect you with hearing aids that are, helpful for the type of hearing loss that you are experiencing or hearing change. The challenge is hearing aids are not covered by Medicare, or at least traditional Medicare. As with most things in the US, we have tried to send this up to the free market. So 2022, a law passed that said we are now allowed to sell over-the-counter hearing aids without a prescription, even without an evaluation. So there are people out there. Costco has become a big source of people's hearing aids, admittedly, and they do sell some pretty high quality ones at prices that are much lower than prescription ones. These days, a quick search last night, hearing aid prices in this country range from around $120 for the cheapest thing you can buy on Amazon to multiple thousands of dollars for the tiny hidden ones. So there are options that meet a lot of budgets. Obviously, the multiple $1,000 ones are usually higher quality, but I do recommend these evaluations. As I said, hearing is really important. This is the Achieve study that we talk about a lot. The Achieve study actually showed the link between hearing and memory. Hearing loss is directly associated with memory loss. It's a known thing. So if we can treat, people ask all the time, what can we do to prevent memory change? Treating hearing is one of the first things that your average geriatrician or your exceptional geriatrician, like Dr. Clark, will recommend. So, hearing aids used to be these big bulky devices. And in some cases they still are. The behind the ear hearing aid is usually the largest. It is also usually the most powerful. So these are the devices that are for folks with really profound hearing loss. Not everyone is going to need or want that, especially if they don't like the look of it or the feel of it kind of sitting on the ear. There are a number of other devices that go as far as the completely in canal, and there's actually one level even beyond. Completely in canal, invisible. It is tiny. I would admittedly worry about that, losing it, not just in the ear. So there are devices that still have the outside, but a receiver deep in. There are the in the ear, and then there are deeper ones. So what do they actually look like? Your behind the ear one, which is in that top left there, is going to be your largest device. This one right here on the bottom right was not featured. That is the invisible one. The device for those online is this little white thing here. It is absolutely tiny and fits right in the ear and kind of sticks right in there. So a wide variety of hearing aids I recommend for folks to at least get an evaluation, and for folks who are thinking about that to look at the National Council on Aging. I'll give these slides. Ed already has these slides if we can put them somewhere, because there is a really great buyer's guide that I linked to there. Not affiliated with any particular provider, just telling people what to look for and how to screen. So that was a lot of talking. Questions, concerns, complaints?
How does hearing and memory interact?
Because it's actually, it makes logical. I had that thought too a couple of years ago. Logically, it makes sense. People who can't hear can't interact with the world in the same way. So you're missing out on conversations. You're missing out on interactions. And that's actually the big thought behind the driver, is that people who can't hear as much may self-isolate more, which is also related. They may not be engaging and kind of using your brain to its full potential.
So that causes dementia?
Mm-hmm.
Also depression, I think that there's a lot of
Yes.
conversation about that,
Yes.
which makes sense.
It also does.
The relationship between hearing loss and balance.
Ooh, good one.
Yeah.
Hearing and ears and balance are directly related in many cases. Balance disorders are caused by one of two things. It is either the connection between ear and brain or within the brain itself. Your doctor will help you determine which. Hearing itself is related, but not as directly. The ears are responsible for hearing. They're also responsible for helping maintain. The ears are the level of the body. They can help you tell what's up, what's down, what's left, what's right. When that process gets disturbed, some people will feel vertigo, that room spinning feeling that for many people is absolutely intolerable. So yes, they are related, and actually balance disorder should be a whole talk on its own. Think about stuff for coming year. Yes.
My ear's blocked on the left side from, I don't know if I sneezed or
Yeah.
what happened. It's been like a month now.
Yeah.
Should I see my PCP or?
Yes. Start with PCP. Start with PCP. May also
They can
general.
refer me somewhere.
Yeah, general advice. for that is also to consider trying, unless you have a reason why you can't, Flonase nasal spray or another topical steroid. The ears and nose are very closely connected. Right about like deeper where I'm pointing, but really deep, there's a very thin canal where pressure equalizes. That canal can get very easily blocked by nasal inflammation. So sometimes some Flonase will help. John.
People I've known who lost hearing in 1 year.
Yeah.
And one of them said that if you wake up and can't hear in 1 ear, you should get.
That's correct.
Away.
Sudden hearing loss is considered generally somewhere between an urgency and an emergency. Sudden sensory neural hearing loss can be caused by a number of things. Viral infections can do it. Sometimes it is what we call idiopathic. Again, we don't know why it happened. But yes, sudden hearing loss should be evaluated the same day.
That happened to me. I was in bed and it was one of those years when the crickets were all out.
Yeah.
And I'm listening to the crickets and I closed this ear and I could hear them. I closed this ear, dead. This room just went dead.
Yeah.
And I went immediately to my ear doctor and said, what a viral infection.
Yep.
Ear loss.
And
Thank the crickets.
in most cases, if it's viral, it'll come back. But there are things like oftentimes with sudden sensory neural hearing loss, we'll start steroids, we'll start other medicines.
It has.
No, and that's the challenge. That is a challenge. Yes.
Just wanted to thank you. I've been worried about my hearing, but I heard every word you said. I really appreciate that.
Thank you.
But you didn't hear all the dirt.
No,
Oh.
I don't know.
And,
Yes.
have you heard this? And I don't know if it happened in our lifetime, but when Senator Andy Kent ran for Senate seat,
Yeah.
one of his platforms was that on basic Medicare,
Yes.
hearing, dental, and vision would be covered.
God, I wish. I mean, I know that there have been, it should be. I don't know where, I mean, right now, I don't think that's happening.
Not in our
At least-
lifetime, certainly.
Well, maybe at least for 2 more years. We'll see. A couple. Michael.
Yeah, just a quick personal story about why you should take your hearing seriously. I realized that I wasn't hearing the TV when I had my certain side of my head on the pillow.
Yeah.
And that was weird. So I went to my primary care doctor and he sent me to an ENT. They did an audiology exam. He took an x-ray, he called me that night and told me I had a brain tumor. And that had killed my hearing in my right ear. And I was, it was a life-threatening situation and I had surgery 4 weeks later. So.
It's important, yeah.
It's important.
Absolutely. Enjoy your pizza, everyone. I'm gonna stick around.
Uh,